Unfortunately, we're living in a world where there's a huge amount of substance abuse going on. And unfortunately, a lot of this, you'll be surprised, is in Muslim community also going on. A lot of these parents who abuse drugs or alcohol sometimes is a very important factor now with the cause of ADHD. A lot of the parents who abuse drugs, alcohol, or mothers or parents, they sometimes have give birth to children with ADHD. It's a very common thing, especially in the African American Hispanic population. It's a significant increase in the ADHD because of significant amount of increased substance abuse and alcohol abuse. So this is something, you do that, psychosocial factors like other things like divorce, separation in the family, or any of the mental trauma, as the doctor was mentioning before, brain trauma. Sometimes the brain trauma or physical trauma can start the whole disorder. Like you need a stressor to kind of start the disorder. You may have a genetic tendency, you may have a chemical imbalance, but the disorder may not start until there is a very strong psychosocial stressor in life. It could be a brain trauma, it could be a separation of the parents, divorce, or any other death of the family members. Very important. Death of grandparents or any other close members is very significant. Don't underestimate that. That also can start the whole condition, full-fledged. And the parents say, well, this is because of the grandfather died. But they don't understand there is a lot of things going on. This child may have ADHD also going on. As I mentioned, anxiety and depression may play a part, and also may be a consequence of this behavior. When these children are not treated, they become frustrated, they function poorly in school, they're failing, they know they're smart, they know they're bright, but they can't function, they can't get good grades. Then what happens? They develop depression, and then the child presents with the mixed symptoms of ADHD and depression and anxiety. And it's become more difficult to treat them, and most of them, unfortunately, they come to us at that level when they really have depression and anxiety. So this is basically a brief preview of our ADHD. Any questions now? You can answer the question.
We have only 4 minutes left for the Salat al-Zuhr, and I have given you this survey. Thank you, Sister Zainab, for such a quick work. You see how good ICOB Academy staff is? They just made the survey, I just put it out, and I got all print up. Thank you, Sister Zainab, for the work. Now, I want everybody to fill out the survey form. If you have any comment, you can write it on the back of the paper. And as we know, we want to thank Doctor for coming, and whatever you have question, make it brief, quick. Yes?
How long is the treatment course? If you diagnose the child ADHD or ODD, are you taking that for life? Are you taking that? Are you going to be evaluated?
Okay, that's a very good question. I'm glad you asked the question. Well, the studies, all the long studies which have been done, long-term studies have shown that most of the time it is diagnosed early. Like if you diagnose a child early, the most likely, almost 2/3 of the cases, if they're treated and diagnosed early in life, they will be able to grow out of the condition. I can't say all of them grow out of the condition, but there is a significant amount of those children, at least I would say by they get into college. I've seen children, I've been practicing for 23 years now. And all the children I've seen in the school years, and they have gone to colleges, they all have gone off their medications, and they're functioning very well. So most of the time, if you diagnose them early, which means you diagnose them as early as in primary school or later, maybe in the middle school, the chances are that they will be able to grow out of the condition once they get at least to the high school or college level, and they will be able to function very well in their life. But unfortunately, because a lot of these children present so late, and sometimes this is a lifelong condition. It's very unfortunate, and you will find now a lot of adults coming up now that they have ADHD, never treated, never diagnosed, and unfortunately 1/3 of those people have this problem all their life.
Okay, one last question, and I have to make some comment after this. Yes, brother.
In our society, there's a big stigma that the parents do not want to send their children to the psychiatrist. They go to the pediatrician or they go to the physician. How do we get our parents educated that when there is a problem with the surgery, we go to the surgeon.
Right.
But when it's a problem in the mental, we don't go to the psychiatrist. So this is something we should...
Thank you, Balbhai. I just mentioned that we do not believe as a community, as a culture. Actually, if you go back in the history of humanity, Muslims were the one who had established mental institution for mentally sick people first. So we actually have come away from it, and we start treating them like this, some kind of a Baba or a spiritual person who have some higher powers and whatnot. The mental disorders are mental disorder, like somebody has a diabetes, somebody has a blood pressure. They didn't invite it happen. Somebody has a cholesterol, somebody has a genetic thing. So we need to start, first of all, recognizing mental illness Our children are our future. So if we do not treat our children properly for their physical and other emotional nurturing, we will not get a good child produced in the future. So, and majority of Muslim countries do not have a higher education level, as you know. We have a very low level of education. So neither the parent knows, nor the child have the opportunity, and the physicians are not available. Most of those countries do not recognize. We came as a professional, most of us are educated, technical, professional. We never had children before. So we don't know what happened. So we are learning with our experience. Most of, with all due respect, our sisters, our wives, they do not believe into healthcare. Men deny healthcare, women don't believe in healthcare. So we are a nation in a denial. We need to start recognizing illnesses are illness. We come to the doctor at the last moment. We come to the physician for a heart attack when it's in the happening. We don't take cholesterol drugs. These are all fraud and this and that. Such and such chemical will do it. No. Mental disorder are similarly, same thing. Our schools, our Islamic school which are established, are doing wonderful job to adopt these children, and we often hear, I'm involved in the board, and we often hear the child had a problem and parents were refusing to accept that the child was disrupted to the whole full-time school class. Sunday school, and I want you to remind all the children, this was one point. When you leave Sunday school, I got a complaint from full-time school principal. You kids are disrupting the class, you are moving their things, you are displacing their papers and just messing up the whole class. Don't do that. They are doing a favor to let us come here Sunday to study in Sunday school. So please, when you leave, make sure you do not change and you do not remove, you do not write on the board, do not leave, damage the product and anything. So that's one of the things. That's your question.
I just wanted to ask one question here. For a 10-year time span, I have seen 2 youth suicides in our community.
Right.
That's a perfect failure from a community part that we have not done for the first time it has occurred. So, as a organization, ICOB, what do you foresee that we should do to prevent such happenings?
Okay, very good question.
I will answer one thing, then I'll let you. This is what we are doing.
But this is just a statement.
This is what we are doing. We started. So we are called psychiatrists who are professional, board certified, practicing physician, 23 years experience, 30 plus experience, trauma surgeon here. We are trying to do things. What we need is community to attend. We advertise for this for more than a month. We distribute flyers. We call different people. We send the chain or robocall. How many are here?
Yeah, but in addition to that, I was saying that do you have a contact number that they cannot talk
No,
to?
we are not that strong, brother.
Or you can refer some number they can contact
Sure.
so that line can be confidential.
Yes, for that simple thing, America have a full-fledged established system. Call 911, there is a crisis unit in every any emergency room, call and go for the emergencies. For private offices, you can call Dr. Siddiqui's office and have appointment and he can attend your problem. He will work with you, whatever his system is, not to market, just to know that if you cannot go to him, go to somebody else, but make sure your child is seen by a psychiatrist, like for a regular checkup. If there's not a problem, at least for their, he mentioned one thing about ADD people. ADD kids have a more than 400 IQ. It's only they don't know how to use their energy. Their brain and body is full of energy, they don't channelize it. To get out of this door, they will break the door and get out rather than turning a knob and get out. This is the difference between the ADD and other people. Yes, sir.
Okay, let me just answer my question. Just want to add to Dr. Farooqi's statement. Yes, unfortunately, we were the leaders in this field, in psychiatry too. And I read a book called Al-Qanun fi Tib. This is a book by Avicenna, known as Avicenna, Abu Lisina. He was the first psychiatrist who established the first psychiatric hospital. And you'll be surprised to know that they were treating this disorders with medications. With medication he was using it. And it's in Qanun fi Tib. And he says very clearly that mental disorders have no connection, no origin from any supernatural causes. And this is Abu Lisina speaking, Avicenna, who was not only a psychiatrist, was a theologian, he was also an Islamic scholar, and he's speaking from that point of view. As Dr. Iqbal Bhai said, yes, the problem is that they need more education. As the other brother mentioned, we need a lot of education among our society. And as Dr. Farooqi mentioned, there are resources available. You can go to your own county. The problem is we even don't go to our county meetings or city meetings, and we don't attend those meetings. There are resources available in your county about the mental health hotlines, mental health counselors, and even if you can go to your insurance company, they can give you a lot of details about it. And I was more than happy to provide you some more information about that. But that last thing about what I mentioned was which I was going to talk about anyway to end this discussion, that anxiety and depression. And the suicide, as you mentioned about the rate of suicide, alarmingly high. Not only in the American population, in the Muslim population. And the main reason, just talking about these disorders like attention deficit disorders, behavior disorders, cognitive disorders, and autistic disorders, all these disorders, when they're not treated, believe me, it can cause an alarmingly increase in the rate of depression in these children. And I have seen patients who have committed suicide just because the child was failing in school. Because the child was failing in school and attempt suicide. It happens. If we don't accept this, it happens. And anxiety and depression, alarmingly, is usually now 10% in the general population. And it's almost the same in the Muslim population also. And these disorders, they stem not only from genetic reason and biochemical, there's an increased amount of psychosocial factors. We have, it's a different topic to talk about, a lot of psychosocial aspects in our life, especially the marriages, the divorces, the separation with the parents, and also with a lot of the, substance abuse and violence and all those things in our society. These are playing a big part in the suicide. And then we want to decrease the rate of suicide, we have to really work together to educate ourselves. That's a very important thing. We have to educate among ourselves and try to use those resources. There's nothing wrong with going and your child being evaluated by a psychiatrist. I mean, you have insurances, you have all the facilities available, why not go and do it? There's nothing going to happen on the medical record or the records. Sometimes they wonder about, oh, my child going to psychiatrist, what happened, the records is stopping from going into army or into another field. No, this doesn't happen. In this country, people suffer from depression is a normal illness here. It's just like diabetes or hypertension. Everybody suffers from it. The president suffers from it. And we have presidents who suffer from depression and dementia. We have also politicians who suffer from it. We hear that all the time. It's just try to get the facts right. This is a general medical illness. Depression itself is a medical illness. We need to get it treated as early as possible. This is a big topic. Maybe next time we can discuss depression, anxiety. Today was talking about behavior disorders. With that note, I'm going to end, and I'm available here. I can get you some numbers, some other information if you want to get that regarding the early diagnosis, treatment of these disorders. With that note, we end and pray to Allah subhanahu wa ta'ala, give us tawfiq to use our religion, because we have to first use our religion, the Quran and Sunnah, to get the strength from it. And please try to educate ourselves, get the resources available, and try to deal with these disorders, because this is very important in our growth in the society. As I mentioned before, this is a big social challenge. And all of the forces in this society, because of our not dealing with these illnesses, can really bring us down in society. So please take it very seriously. With that, I end. ولا استمسانا في خص الذين آمنوا بالصلاة وتواصوا بالصبر صدق الله العظيم والسلام عليكم ورحمة الله وبركاته.
Jazakallah. Thank you. Takbir. 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 Come on, guys, wake up. Takbir.
Any question?
Any questions? Yes.
As you have spoken on depression, so I would like to ask you, have you done any study, or have you seen in your 23 years experience a person who is more religious would be less depressive as compared to a person who is not that much religious?
Well, honestly, some of those psychologists, and I know they have done some studies. I don't have the exact details of those studies, but Dr. Sayyid Hassan, he has done studies about that. He has books about that, the psychological perspective of mental illness and Islamic perspective of that. Of course, we know that most of this depression means when we have connections to different worldly things, like connections to job, security, connection to wealth and car and all those things, and of course to all the children and all that, and we don't have the connection to the Allah. And when this connection, for God forbid, if they are cut, then this person is a free fall. If you have no connection to the God, then of course you have a free fall. But if you have the connection to the God, it plays a bigger part in you able to withstand that. There is a book called Don't Be Sad. I forgot the writer. You should get that book. It's by a very Islamic scholar. And in that book, Don't Be Sad, you can find a lot of ways how you can use religion and Islam and the Quran and the Sunnah of Rasulullah to seek strength from it, how to prevent this depression and anxiety. It's a very good book. I think you should all get that book. And of course, there may be studies, I am not aware of there may be studies going on. Dr. Hassan Nasr is doing a lot of studies, and I can, get those studies for you, and give you that information, inshallah, in future.
It's a big topic, but inshallah, what we will do is, you see, this is a lifetime learning. This is medical profession, 23 years of college education, and we want everything to be explained in very nutshell for people who are not from medical background. Is really not a service. So inshallah, we'll assign for next time another topic, and we'll try to pick, and we'll have other speakers. Inshallah, we'll be diversifying also this talks, some of the IT talks and some of the other. We'll also like to have our youth to speak about it. We'll be doing every quarterly something like that, so inshallah, that will have a better return. So with this, we'll make the dua to Allah subhanahu wa ta'ala to thank to this brother, particularly Dr. Abdul Qayum came from very far from Elizabeth. Dr. Wahid Usman, trauma surgeon, he took his time off. This takes time. And brother Siddiqui, his daughter is getting married. They took time out to come to teach us, but the people have no time to come and learn. It's like, राह दिखाएं किसे कोई राह रोए मंजिल ही नहीं तो कोई चाहता ही नहीं सीखना तो किसको क्या सिखाए तो thank you very much for coming. Tell other community members, and inshallah we'll have the Salatul Zuhr, and with that we will make the dua. All the children, remember, you are not supposed to disrupt the classes and their setup. You are here to study, you are here only for 4 hours, and other children who come here every day for 5 days, every day of the week, their class should not be disrupted by our Sunday school student. Thank you. Jazakumullah khair.
Thank you, sir.
And thank you very much for coming for the volunteer time. And I have the survey. Sisters have not given me the survey. I want sister survey.